day, Miss Rana. I am Gloria Magbarno from A18 and I will be performing to you the vital signs. These include blood pressure, heart rate, respiration rate, temperature, and additional for that is pain rating and oxygen saturation.
Gather all the equipments that is needed. These include sphygmomanometer, stethoscope, thermometer, paper, pen, cotton, pulse oximeter, watch with second hand, and alcohol.
In cleaning the equipments, we will use warm water with detergent and alcohol. Then, for rinsing, we will use cold water and a cotton balls. This bowl here, a warm water and a detergent, we will put some alcohol and mix it. Then, for this bowl, it contains cold water for rinsing the equipment. In cleaning the equipment, we will start for the thermometer. In thermometer, we will use alcohol. Then, get the alcohol on its container, open. We will start in the tip, then down. Then we will use another cotton, a sterile cotton, and it is clean. Then we will put it back on the sterile container. After that, we will clean the stethoscope. In cleaning the stethoscope, we will use the warm water with alcohol and detergent. We will start from the tip of the stethoscope. Then for down. Another for the side of the ear tips. For rinsing, we will use the cold water. Another for the side tip. Then for drying, another cotton, clean cotton. Start for the tip, like this. Then, down. Another for the other tip. Then, down. Then put it into a sterile surface. For the pulse and watch with second hand, we will use alcohol. Here. Here's the pulse. The side. Down. Another. Then open. Then for drying, a clean cotton. Then put it into a clean surface. The watch. We will use again the alcohol. So that the all equipments that we will be using is sterile. And we are done. Then the garbage, we will dispose it into a clean paper bag. After cleaning all of the equipments, again we will perform a hand hygiene. This time I will Perform again the hand washing technique. And the next to this is provide privacy of your patient through closing the doors. Hi ma'am, I am Gloria Magbanwa, your nurse for today. I will be assessing to you the vital signs. This include blood pressure, heart rate, respiration rate, the temperature, and additional for that is the pain rating and oxygen saturation. Is that okay for you, ma'am?
Yes, ma'am.
Okay. May I know your full name, ma'am?
Gloria P. Magbanwa,
Birthday?
May 26, 1957.
Age?
64.
To know the pain rating, it is important because it can affect your vital signs. It can increase the blood pressure, heart rate, respiration rate, and to know that, you can scale the patient as 0 as no pain at all, then 10 is the highest. And you can ask if the patient is undergoing surgery or any traumas. Okay, ma'am. May I ask if you undergo surgery or some kind of trauma po?
Yeah.
Okay. Can you tell me your pain rating as 0 as no pain at all, then the 10 is the highest?
0.
0. Okay. For oxygen saturation, in obtaining a good findings, you can pick the finger with a good circulation. Normal saturation is 95 to 100%. Oxygen saturation, ma'am. Can I hold your finger? Just okay. Then okay. For body temperature, there are 3 methods: the rectal, oral, and axillary. For this session, we will use a axillary method. Wait, ma'am. Then, for that, body temperature.
Use alcohol to clean the thermometer. Start in the tip of the thermometer down the bottom. Raise the arm of the patient. Then insert
We'll be using
the digital
axillary.
thermometer at the axillary. Make sure that the tip of the thermometer is at the center of the axillary. Then wait when it beeps. When it beeps, remove the thermometer. Then look at the digital display of the thermometer, then record it.
Celsius po. 7 Celsius.
Use again alcohol to clean the thermometer and put it back in the container. And the next po is the radial pulse. Use your three fingers, middle fingers, to locate the radial pulse. Then, for the respiration rate, you can act that you still record your radial pulse or the heart rate. This time, I record the respiration by watching the patient's chest without telling her, then counting her breath per minute. Okay. Your heart rate is 82. Then your respiration rate po is 27 breath per minute. Then, both heart rate and respiration rate, I record it as a full minute so that it is easy because my patient have a irregular pulse. So I record it into a full minute. The normal heart rate is 60 to 100 beat per minute. Then for the respiration rate is 20 to 30 breath per minute. Assist the patient assume the correct position. Extend the arm with the palm facing upward. Remove or rearrange clothing to expose the area where the cuff will be applied. Place the cuff approximately 1 to 2 inches above the inner aspect of the elbow with the bladder over the bronchial area. Arrange the manometer gauge at the eye level. Palpates the bronchial artery or radial pulse by pressing gently with the fingertips. Tighten the screw valve on the air pump and inflate the cuff while continuing to palpate the artery. Note that the point of the gauge where the pulse disappears, deflate the cuff and wait for 15 minutes. Place the stethoscope earpieces in the ears properly, then position the diaphragm of the stethoscope firmly but with as a little pressure as possible over the artery where the pulse is felt. Do not allow the stethoscope to touch clothing or the cuff. Pump the pressure 30 mmHg above the point at which the pulse disappeared. Note the point of the gauge at which there is an appearance of the first faint but clear sound, which the systolic pressure. Read the pressure to the closest even the number. Place the stethoscope earpieces in the ears properly. Then release air entirely from the cuff and remove the cuff from patient's arm.
Okay po, your blood pressure is 130/70, which is normal at your age po. You are 64 years old, a senior citizen.
Then observe proper hygiene.
For your overall record is your pain rating is 0, then your oxygen saturation is 99% and 75 heartbeat. Then for your body temperature is 36.7 Celsius, then your heart rate is 82, and your respiration rate is 27 breaths per minute. Then for your blood pressure is 130/70, which is normal. After cleaning and keeping the equipments that we used earlier, we can perform hand hygiene through washing our hands.